Good afternoon. My name is Daniel de Backer. I'm the head of the Department of Intensive Care at Cherry Hospital here in Brussels, in Belgium. And I will discuss you some specific aspects of the Kawasaki-like syndrome in adult patients with COVID-19. Kawasaki disease is an acute vasculitis of childhood that leads to coronary aneurysm in close to 1/4 of the untreated cases. It is often described as a clinical syndrome by 4 to 5 symptoms, including the erythema of the lips, strawberry tongue, the bilateral conjunctival injection, maculopapular rash, and erythema and edema of the hands. Also, cervical lymphadenopathy is also important and usually unilateral. Patient presenting 4 of these symptoms, and especially patient presenting coronary aneurysm, are considered to have the Kawasaki disease. The description of the association with of Kawasaki disease with COVID was first done in April with a case of a 6-month-old girl presenting all classical Kawasaki disease criteria and a PCR positive for COVID-19. Shortly after, in early May, in UK, a series of 8 children was also described. And among these children, most children presented shock, myocardial dysfunction, pleural effusion and pericardial effusion, and skin lesion. One of these children also presented coronary artery aneurysm, and there was association with COVID-19 disease. And interestingly, in the next months, there were reports from many countries, including Italy, France 2 times, US 2 times, all these series including several children and young adults with COVID-19 associated Kawasaki disease. Interestingly, compared to the classical Kawasaki disease, the median age of these patients were relatively older, around 10 to 12 years for most of these children. But it was still restricted to children and adolescents in this series. We have described, and several others later, the case of Kawasaki disease occurring in young adults. In this young adult of 19-year-old, what we observed is that indeed we have the clinical pattern of the Kawasaki disease with fever, adenopathy, rash, conjunctivitis, lip edema, associated with some other signs of the COVID-19, including the myocarditis and the RDS. And all these occurring within a time frame of several weeks after the first symptom of the COVID infection. Interestingly, in that patient, we observed severe myocardial dysfunction associated with a low blood pressure and significant tachycardia. Just after administration of tocilizumab, inhibitor of IL-6, what we observed is a decrease in the tachycardia and an increase in the mean arterial pressure in that patient. Also, very interestingly, what we observed is that after administration of tocilizumab, we had a decrease in the troponin levels, and after the consequent administration of immunoglobulins, we also observed a decrease in eosinophil and normalization of the full feature in that adult. When we perform the coronary angiography, what we observed is the presence of an aneurysm in that patient shortly after the diagnosis of the Kawasaki disease. And interestingly, after administration of methylprednisolone, what you observed is after steroids, we had a normalization of the coronary disease in this patient. Shortly after, some other cases in adults was also presented. Here, a male of 40 years old, and another patient here, a female of 30 years old, also presenting this Kawasaki disease in adult. So is it really the result of direct viral infection or immune response to the SARS-CoV-2 infection? Well, it's interesting to realize that it occurs the peak of incidence of the Kawasaki disease occurs later than the peak of the COVID-19 hospitalization. And this was observed in many other reports. Also, most patients were diagnosed based on serologic tests rather than on real-time PCR, so suggesting that it is an immune response much more than direct infection by the virus. What are the similarities and difference between the Kawasaki disease and the Kawasaki-like disease and the SARS-CoV-2 infection? Well, we have several cases here, all present the skin lesions here, but this is really uncommon in COVID-19. Interestingly, also what we have is that in Kawasaki disease, the RDS is usually not reported, which is quite the case, of course, in COVID-19. So this Kawasaki-like disease is associated with the features of the Kawasaki and the features of the COVID-19 on the other hand. So there is really a mixture of different features of the COVID-19 on one hand and the Kawasaki disease or Kawasaki-like disease, with some of the features that are common, like the skin factors and so on, and some that are uncommon with the COVID-19 and the Kawasaki disease. What about the therapeutic interventions? Well, for the Kawasaki disease, there are very specific treatments that should be used. In particular, there was strong recommendation for use of immunoglobulin in patients with Kawasaki disease associated with aspirin. Also, we may consider methylprednisolone pills with patients not responding to the primary treatment. Importantly, tocilizumab in pure Kawasaki disease may be associated with development of the coronary artery aneurysm. So this may perhaps be something to consider. But it is interesting that in the Kawasaki-like disease, many children receive tocilizumab without adverse reaction and without developing the coronary artery aneurysm. And also, there was a marked improvement in respiratory, also cardiovascular function in patients, children, and also the adult patient we observed. So it seems that there is a slight difference there with the classical Kawasaki disease, and that tocilizumab may be used in these conditions. So in conclusion, the Kawasaki-like syndrome can be observed in adults, and it is and can be associated with coronary aneurysm. The skin reaction, conjunctivitis, lipedema, strawberry tongue, and adenopathies should be cautiously searched in patients with COVID-19. Also, abdominal symptoms are quite frequent in these patients. The Kawasaki-like disease includes the typical features of the inflammatory reaction, also called the cytokine storm. And recognition of the syndrome is important as specific therapies are required in these conditions. With this, I thank you for your attention.